Now we are totally live. I'm just going to check the Facebook page. I'm pretty sure we are live and we should be good to go. So, hello, Dr. Shannon. How are you?
I am doing so well. Good morning, Brandi.
Thank you so much for taking the time to join me today. I'm so excited to be able to chat with you and introduce you to our Nutrimetrics family. I know you're going to be working with us on the 14th during our Nutrimetrics convention, and I know you have an incredible story to tell, and I want people to understand why they should tune in on the 14th and learn from you as you talk about kind of why we need wellness solutions now. So let's get started by just going over a couple things about you. Can you give them a little bit about your background, tell them about your practice,
Sure.
what makes you unique, and why you chose Nutrimetrics?
Absolutely. So I'm Angel Shannon, and I'm an adult geriatric nurse practitioner in Maryland. And I've been a clinician for now, this is my 27th year. So it's like really so crazy how time goes by so fast. But I've been in private practice since 2014. And I've worked, just a little background, I've been in critical care, I've been in ER and trauma. I've been in community health, public health. I worked for insurance companies. So I have a lot of background in lots of different areas in medicine. And one of the things I always say is that I'm a clinician first. Like I absolutely love working with people. And I love seeing people like go through their own health journey, like from the beginning of, hey, I think something's wrong, to moving into solutions finding and then putting things in place and then seeing people get better. So I always say that, given my background, one of the things I've always loved best is just being out in the community. So in 2014, I launched my practice, which is Siva Health. And Siva is a Sanskrit term which means to serve. So at the heart of my practice and all of my work, whether it's working with Nutrimetrics or working with my patients one-on-one, my mission really is all about just serving. So that is really like where I'm rooted in, is just serving others and, being solidly rooted in community and public health and education first.
That's beautiful. Can you tell us how you were introduced to Nutrimetrics? Like, how did you go from opening your practice in 2014 to now being a Nutrimetrics health professional? Was it a Nutrimetrics consultant that came into your practice on a cold visit? Was it a warm referral? Let them know a little bit about how you were exposed to Nutrimetrics.
Oh, it's a wonderful story. So one of the things that I had come up against in in clinical practice when I was working for others before I started was, we had the 20-minute appointment visit, 15 minutes, get in, get out, that type of thing. One thing that always bothered me was, how do you let someone come into your practice with, let's just say, diabetes, and you say, hey, you've got to lower your A1C or you've got to lower your cholesterol. Well, you're telling me what to do, but you're not telling me how to do it. So I was really, really frustrated by that. And in the practice that I had worked in, and where I was before I started my own practice, they had Nutrimetrics there, products. But it was, as I said, with that 20-minute sort of model, it was just like not a whole lot of time to educate people on things. So I had filed that in the back of my mind, never really thought about it much. But when I went into my own practice and knew that I had a different visit model, my visits are a little bit longer than 20 minutes, usually about 30, 35. One of my nurse practitioner friends said, Angel, you are so rooted in education. She said, do you remember we had those products at the old practice where we were? And I said, yeah, I remember. And she said, why don't you look into that? I said, okay. And I, again, put it in the back of my mind. And then just saw more and more patients coming in that weren't really looking for primary care anymore. They were really looking for lifestyle medicine. And because my background is also that, I've spent a lot of years studying mindfulness and meditation. I'm a 200-hour registered yoga teacher and yoga therapist. So I've got all of this in my own personal background, and it sort of infiltrated into the practice. And I had more people coming in saying, hey, listen, you know what? I want to learn how I can do this naturally. I don't want medications. I don't want, prescriptions for things and whatnot. And I said, you know what? Let me go back and take a look at this Nutrimetrics. And I wanted products that I could put people on, supplements and things like this that I, number one, knew would work. Number two, had a solid history of patient education. So I got on the phone, well, first got on the internet. So let me do a little research for myself. Went to a Nutrimetrics website, blown away, absolutely blown away. I mean, I could spend all day as a clinician reading the studies that are lined underneath the products. But what I loved about it when I looked is I don't need to be a clinician. If you're just a regular consumer coming to a Nutrimetrics website, there's so much empowering education. And that was what, did it for me. So I made a call, got connected with a regional, person, Big Al Yinch down in Salisbury. And I knew right away, this is what I want for my patients. Beyond the products themselves, I wanted, I wanted a solution that that I could implement right away, that people could access and be educated at their own, knowledge level. It's not, something that's rocket science. This is something that average consumer can get in, be educated about, and and start making a difference in their lives.
No, and I know you had mentioned lifestyle medicine, and that's one of the things that we talk about at the NC training is kind of the evolution of medicine over the past few years. And the College of Lifestyle, American College of Lifestyle Medicine started in 2004, which is the same year Nutrimetrics started. I find that interesting, just a little coincidence, if you believe in coincidence.
Yeah.
But there are more and more patients that are asking their practitioners for natural alternatives, but also just how can I live my life in a way that promotes health. And so we are seeing more of that emergence, not even just with the practitioners, but with the patients asking for practitioners to provide lifestyle medicine. And so I'm glad you brought that up. I think that's really important for all of our practitioners and our nutrimetrics consultants to understand. And so since you were introduced to the products through nutrimetrics, how has your practice changed? Like what kind of benefit have you seen by offering the nutrimetrics products to your patients, either with your patients or with your practice?
Oh my goodness, that's a fantastic question. People are busy. They're living busy lives. No longer can you say, let me back up. If you want to see real change as a clinician, you've got to be able to put some things in place quickly, make it easily accessible. You've got to make it almost impossible for the person not to see benefits, right? So no longer can you just hand someone a prescription or a leaflet or whatever and have them come back 3 months later or what have you, and think that things are going to change. It's just not going to change. People are living busy lives. They'll take that leaflet, they'll put it to the side, and all of us, we all have the best intentions. We say what we're going to do, and then life creeps in and something happens. The thing that has worked so well for me is that, for one thing, I also implement, well, I am also a functional medicine practitioner. So I do a lot of lab testing. So when people come to me, I do gut health testing, I do nutraceutical testing and whatnot. They've got numbers in front of them. So those are actionable items. From there, we go straight into, here's the solution. Here's the vitamin D. I keep this, keep stock in the office. Here's the vitamin D because your levels are low. Here's why they're low. Here's your lab results. And then here's an educational thing, and all of that is right in front of them. So Nutrimetrics has made it possible for me to jump right in on something right there during the appointment, whether it's a telehealth appointment or whether the person is right in front of me. The products are right there. They're easy to take. We've got educational leaflets to explain. I even have it set up on my desk. Here's a little cup. Here's the water. Here's how you're going to mix it. I even do like a little taste testing. Hey, try it out right here to see if you like it. So it's made it so easy for me to get patients going right away. We have done a lot to automate our practice. So we use a patient portal. So we send, supplement recommendations through the patient portal. Right after they leave the appointment, they get that, that follow-up. Hey, great to see you in the office today. Here's the link. They go straight away to what it is that we're recommending for them. So, it's really, really seamless because, we've got telehealth built in. We had telehealth built in when I started the practice way back in 2014, before any of this, new development. So we had that already. So now it's literally just a link to the the site where the products are, a link to their education. Everything goes through the portal, and it has really taken off. I've seen, and I'll tell you, Brandi, the biggest difference I've seen in my patient population, two groups. Ones who want to lose weight with the TLS, seeing amazing results, and also my mental health population. When I tell you the mental health those who are wrestling with insomnia, depression, anxiety, things as simple as the B complex, the vitamin D, the Bliss product. I mean, I've seen tremendous benefit between marrying, the lab results and, things that they need to do from that end with the nutrimetrics. Tremendous, tremendous results in those two populations.
That's awesome. And I love that you just gave, without even realizing, I think you gave so many tips for other practitioners on how to implement. And you brought up the telehealth conversation, which is, something new for a lot of practitioners. There are a lot of practitioners that up until recently weren't really embracing telehealth. And to be able to show that whether they're seeing patients in person in the office or whether they're supporting patients through telehealth or online avenues, things like your patient portal do make it easy to be able to recommend the products, and patients can purchase directly from there. And so that's a really great tool for any practitioner, no matter what their specialty, to understand that we can do that.
Exactly. And to think of the patient portal, not as, to think of telehealth, not just as, okay, well, is insurance going to pay or aren't they going to pay? But just to think of, when I put it in place, it wasn't even about whether insurance was paying for it. It was just all of the things that it enabled me to do, to go over lab results, to be able to do education. I back then I was using it a lot for just education. Hey, let's talk about, were you able to get that fiber, that we were talking about? Did you start the nutrimetrics? How do you like it? And they would say, well, Angel, it feels this way. And I'd say, okay, well, then let me send you some more education on that. So it wasn't so much about whether insurance was paying for me to use the telehealth as much as it was a tool that enabled me to be engaged with.
Yeah, improve patient engagement, and that improves patient compliance, and then that improves patient outcomes. And then I'm sure that creates new referrals, because as you help improve the patient outcomes, they're bragging on you to all of their friends and family, which helps grow the practice. And it's truly a win-win.
It really does. You're absolutely right. Because when people feel better, they tell everyone how they're feeling. And guess what happens? Everyone wants to know that the next natural question is, well, what are you doing? Because I want to feel that way too.
Yeah. No, I know you also are passionate about helping to introduce nutrimetrics to other health professionals so they understand how it could benefit their practice. Any final tips? I know we wanted to try to keep this short and sweet so people could meet you and then learn more from you on Sunday. Any final tips for practitioners that might be evaluating nutrimetrics as to why they should take a look at nutrimetrics for their practice?
You know what? It comes back to what you said in the very beginning. If you're not aware right now that medicine has made a major shift, not just because of COVID or anything like that, it's just where people's mindsets are now. Medicine is lifestyle medicine now. And I say, you've got to make this shift now to get on board with a whole new population of people who want to do things naturally. They want to do things sustainably and over time. I can't think of a better solution than nutrimetrics, because of the science is there behind the products. The educational resources are there. The infrastructure is there to make it just simple, painfully simple to weave into your practice. And it's just a wonderful solution. And not only that, the educational opportunities for us as providers and clinicians to always be getting refreshed and updated on the latest science and the latest data and clinical studies and whatnot. It just makes it a no-brainer for me.
I totally agree. Thank you so much, Dr. Shannong, for joining us again today. I know your schedule is crazy. We all have busy schedules right now, but I know being a practitioner with a busy practice, I appreciate you taking time out of your practice to speak with us this morning. And then again on Sunday, for those of you that want to learn more from Dr. Shannong, Sunday, June 14th, we're going to be doing the Nutrimetrics annual convention. You can register on Zoom, or you can watch it on the Nutrimetrics NC Facebook page. But Dr. Shannong will be one of our special guests with us on Sunday the 14th. And we'll be looking to see you again soon. Thank you again, Dr. Shannong. I so appreciate it.
Thank you. Have a great day. See you Sunday.
You too. Bye.
Bye-bye.